episode of PT Louise, and for this particular video, we're still performing knee strengthening exercises, but this time, we're going to do more functional activities so that you can just perform the exercises even if you don't have the equipment at home, okay? Just make sure that you are still minding your knee joint and your pain and your symptoms, and you perform it at your own pace, no? So if you're having difficulty, you could always take a rest and take a break so that you can recover slightly and then perform another set of exercise, okay? So, same as other strengthening exercises, you still need to be able to engage your core so that you can have a more stable posture. Number 2 is still perform the exercises within the pain-free range or the available range that you can do. And number 3 is I want you to count out loud so that it will serve as an additional help in your breathing. So for the first exercise, we're going to perform the sit and stand exercise, basically just using the chair. So what we want to do is just to sit and to stand from the chair. This exercise could be easier or harder depending on the actual height of the seat, okay? So the lower the seat height, the harder the activity, and the higher the seat height, the easier the activity. But if you're not experiencing symptoms, you can just use the regular seat height and perform the particular exercise. Let's assume that my affected leg today is the left side, okay? So now let's perform the exercise. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay, so for the next exercise, we need a small towel or a rug that we can put on the floor and step on. Okay, so basically what we want to mimic in this exercise is the floor sweeping motion, but it is also mimicking a lunge motion. Okay, so basically what we want to do is to shift all our weight to the left side and move our right side to strengthen the muscles of our left leg, okay? Okay, so for this particular exercise, I want you to take note of the distance of your moving leg, okay? Because the farther the moving leg goes, it is the harder for the exercise. And then, of course, the shorter movement will be an easier exercise, okay? So, let's try to practice. We have to perform it for 10 repetitions. What I want you to do is when you're moving your leg backward, you slightly bend on your affected leg, okay? Now, if you cannot perform the exercise without any support, you can always use a wall, a chair, a table, or any support surface that you can hold on to, okay? Then, when we put back our leg, we can try to straighten up both of our legs and stand up. So, basically, it's like this. Okay, so let's perform it for 10 repetitions. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay, so for the next exercises, we call it the step up and the step down, but since I am in my room, so I don't have the step here or the stairs, so I will use this tool to act as the step that we can pretend on with going up and going down, okay? Now, for this particular exercise, since we want to train the left side because it is the affected side, so we will focus on that side first. But of course, you can also perform the same exercise on the other leg to balance the strength of both legs, of course, because you want to maintain symmetry of the strength of both of your legs rather than just focusing on one. But for this demonstration, I'll just show you one. Now, here's what we're going to do. The stance leg or the affected leg again will stay on the step or the stool. And then the one that will move is the unaffected leg or the right leg. You have to make sure that again you bend on your hips and your knee just to provide enough movement. Okay, so you don't have to step back too far and step forward too far. Okay, so first step on the affected leg. So this is my left leg, which is the affected leg, and then just to stand it like stand on your right like this, and then go up. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay, so for the next exercise, so what we want to do is just to step both of our feet on the stool or the stairs. And then, again, leaving the left leg or the affected leg on the step, you put down the opposite leg downward and try to control your left leg in going down, okay? So basically, it's just like this. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Alright, so those are the 4 functional exercises that you can perform at home that could help strengthen your knee musculature. So another reminder, just perform 10 repetitions of these exercises for 3 sets at least once a day. You can do exercises for both legs so that you have a balanced strength for both of your legs. And of course, you can take a break and take a rest in between sets so that you will not get tired. And of course, you will not have an increased symptoms that you're feeling right now. Okay? So, I hope you find something meaningful in this video. I hope you can perform this exercise to improve your condition. And thank you for watching, and I'll see you on the next one. Bye!